Before we start, I'd like to thank the team at pharmacyshows.co.uk who have sponsored this podcast, enabling us to further our mission to support the well-being of our pharmacy family. Hello and welcome to A Dose of Wellbeing, the Pharmacist Support Podcast. I'm your host, Melissa Cochran, Wellbeing and Development Senior Manager here at Pharmacist Support, the profession's independent charity. We're delighted to bring you inspiring stories, tips, and expert insights that can help enhance your well-being and make a positive impact in your professional life. This podcast is all about supporting you, our pharmacy family, as you navigate the challenges of the profession. We're delighted to welcome Anthony Singh to the podcast today. He's lead clinical pharmacist and BMS-accredited Menopause Specialist in Northwest Leicestershire GP Federation. Anthony is an award-winning clinical pharmacist and British Menopause Society accredited specialist. He's recognized nationally for pioneering the UK's first pharmacist-led menopause clinic. As lead clinical pharmacist at the Northwest Leicestershire GP Federation, he leads a team of 30 pharmacists and oversees the region's women's health hub, delivering innovative services in menopause, cardiovascular health, and long-term condition management. Anthony plays a key role in shaping primary care strategy, having expanded his federation's pharmacist workforce from 1 to 25, whilst developing scalable, patient-focused services such as enhanced access clinics and digital consultation models. His menopause clinic has treated over 1,500 patients to date, significantly reducing GP workload and private healthcare reliance. We're delighted to speak to Anthony about an issue which will affect roughly half of the population, although it could be argued that it's more if you take into account partners, families, workplaces. And for far too long, it's been hidden or stigmatized. I'm delighted that conversations about menopause are becoming more the norm, and I'm really looking forward to today's conversation. So welcome to the podcast, Anthony.
Thank you for having me. It's a privilege to be here.
Wonderful. I thought we'd maybe begin at quite an obvious place, which is that you are a man working in women's health, and particularly in menopause care. I'd love to just hear a little bit about your journey and what brought you to this place.
I think simply comes down to you don't pick what you fall in love with. And I identified a need pre-Davina McCall's TV programs many years ago on menopause, and I identified that menopause and HRT care wasn't to the standard I was expecting. Women were often prescribed antidepressants, especially in certain cultures. Women can be suppressed in terms of asking for help or managing those symptoms, and are just told to put up with it. So I wanted to address that need, and I am obviously a Punjabi by culture, and generally speaking, women aren't as vocal as I would like them to be. So I almost did this for personal benefit to help the people in my family and in my culture, and it just snowballed into what it is now, and it does take over my life, but very much in a good way.
Amazing. That's wonderful. So I guess it would be nice to know, you've seen a lot of women going through menopause. How do you see menopause affecting women?
Menopause affects not just women, like you stipulated at the beginning. Menopause affects everybody.
Yeah.
Men, women, children. I appreciate women suffer the brunt of the symptoms, but it's everyone's responsibility to understand what menopause is. And we live in a different generation now. That's a little bit more possible than it was in yesteryear.
Yeah.
Menopause affects women in particular in a number of different ways, but the main two ways would be physically and psychologically. So women can get physical symptoms, hot flushes, night sweats, vaginal dryness, or they can get psychological symptoms, brain fog, memory loss, anxiety increase, mood fluctuations. And it's important that women feel empowered to be able to ask for help for that journey of menopause. Menopause isn't, I always say, it's not a chest infection. It's not going anywhere anytime soon. Menopause is a period in a woman's life, and it will last a a good 30 years in most cases, because there is no end date, and a new version of a woman with new tools is necessary. And HRT is just an element of that. Menopause as a whole looks at physical health, nutrition, weight loss, and then medication is just a small section of that.
Okay. And you just mentioned 30 years. My understanding is that women can start suffering symptoms years before they actually reach menopause. So were you considering that time in those 30 years, or would it even be more than 30 years if you're talking about perimenopause as well?
It can be. Women can experience symptoms much earlier. If they're menopause symptoms, or perimenopause in this case, would be yet to be decided. Women can have premenstrual symptoms very, very young. You can also have patients who suffer premature ovarian insufficiency, or POI, and where their body stops producing estrogen younger than the age of 40. Women can go through early menopause, which is anything between the ages of 40 and 45, and then perimenopause is anywhere between 45 and about 55, and then 55 and above is what we would class as postmenopause. But the whole journey is what we would call menopause, the Latin word being menarche, and the arc being the umbrella of that journey of menopause.
I mean, if we're talking about it starting potentially around 40, 45, it seems like there probably needs to be a bit of a mind shift, because when I was younger, you definitely thought of menopause as being something that happens to really old ladies. But the fact is, we're talking about like half your life, really, with lifespans being what they are these days. So in terms of perimenopause, I've met several women who've kind of been through perimenopause and in retrospect go, finally, I know why I was suffering so much. What kind of things can women look for that would give them a clue that maybe it isn't just anxiety or depression or mood swings, but she may be at the earlier stages of going through these symptoms?
The symptoms of menopause are relatively well published due to social media, celebrities, new books that come out quite regularly. But women can often suffer hot flushes, night sweats, mood fluctuations, drop in libido, increase in anxiety, skin changes, hair falling out, brittle bones, memory, brain fog. There's 43 registered symptoms, if you will. But when you have a lady who's going through menopause, it's important to take a good history and look at the whole patient, just because you wouldn't necessarily deem a symptom perimenopausal symptom doesn't mean it's not for that woman. So yeah, symptoms can be quite broad, and that can also be a confusing thing as well, because symptoms can be easily confused and misdiagnosed as other issues such as depression or anxiety.
Yeah. So if you were talking to a woman who's, say, 42, for example, and she's not seeing any changes physically, in her cycles, for example, but she's suddenly starting to feel anxious and she's never had anxiety before. Would you start thinking this could be due to a hormonal change?
It's a possibility. And there are certain blood tests that we can do. We repeat those blood tests to get a higher level of accuracy. But even when we do the blood test, we still treat the patient and not the number. So it's, and I would recommend that to be done by a specialist, but looking at that patient, looking at the risk factors, and then if needed, you can commence HRT, but I'd recommend that be done by a specialist, just to make sure that we aren't misdiagnosing the patient.
Right.
The earlier someone takes HRT, the better it is for the patient from a bone health and a heart health point of view. So there are benefits to being inclined there, but it's about making sure that we're not missing anything if you do get a 42-year-old who comes into your clinic that wants to seek menopause care.
Okay, that's great. So what difference do you see in women's lives when they do get treatment for menopause?
So the benefits that the benefits that you'd expect to see for women is an improvement of those menopausal symptoms. What I always find is there's a weird phenomenon I find. You either get patients who present to the clinic right at the beginning of that journey, so about 44, 45, 46 years old, and they have just started to get symptoms and think, oh, I can't deal with this, I need to go on something now. Or you get those patients who are a little bit older, 57, 58 years old, towards the end of the journey or menopause, or coming to postmenopause, and the symptoms have got too much. It's very rare that we get those patients in the middle. And the benefits for them can be not only physical, so it can reduce their hot flushes and their night sweats, but can also make their relationships better because they can manage their mood and anxiety a little bit better. And that's often forgotten, and we can often just look at the physical symptoms of menopause. And one thing I always like to point out to people is 79% of women will get hot flushes and night sweats. That's 21% of women that won't get any night sweats or night sweats or hot flushes, and therefore we can often misdiagnose those patients and unfortunately prescribe them antidepressants. And I'm trying to create a world where we get a woman of a particular age and then tailor that treatment to her.
That sounds really interesting. So in terms of treatments, what kinds of things are available? I know we all probably know about HRT. Are there other things that might be available too?
There's lots of different treatments, and that can be really confusing actually, all the different types of HRT that are available. And there's going to be 4 new ones that are launched this year alone within the next 3 months. So it's only going to get more challenging, but there is a benefit there. There's more options available to patients. In terms of other treatments, patients can seek CBT therapy to look at the cognitive side of menopause. I often think that menopause feels like quite an isolated journey, but it shouldn't be. In Northwest Leicestershire, we have menopause groups and menopause cafes, which are organised by our council, and that can be a source of treatment. We also have a partnership with a mental health company called Vitamind, so patients can be referred for counselling for menopause. So those types of things that I would recommend for patients. It's not, we need to look at the whole patient and not just the medication element. The other thing that is often missed is looking at vaginal symptoms and treating that as a separate issue rather than just brushing past it, shall we say.
Okay. And so if there's someone who either doesn't want to or isn't able to take HRT, you've mentioned a lot of other options. Are there any other things that might be helpful in terms of, I don't know, maybe supplements or something like that?
So there's a few non-hormonal treatments. There's a few. So obviously, as pharmacists, it's important to caveat that the evidence behind them isn't as substantial as we would like it to be. But the two that women often gravitate towards are things like black cohosh, spelled COHOSH. Everyone always asks, so I always spell it now.
Okay.
Evening primrose primrose oil is probably the most common one that most patients are aware of. Magnesium for sleep is often a very good herbal remedy for patients to try. Outside of that, the evidence is vague. A lot of people will talk about things like red clover or lion's mane, but we don't have the evidence to back up the benefit for patients with them. Now, there are medicinal treatments that we can prescribe for patients that are unable to take HRT. So, for example, with a history of breast cancer, and those usually stem around SNRIs, so things like venlafaxine, or SSRIs like paroxetine or fluoxetine. You have clonidine, which is a blood pressure medication traditionally, but it can be prescribed for hot flushes. And we also have pregabalin and gabapentin. However, I appreciate most pharmacists will often avoid pregabalin and gabapentin, not only because of the side effect profile, but because of the risk of dependency. There is two new drugs that have just come to market from Bayer and Astellas. One of them is called Veoza, which is non-hormonal, and it only treats hot flushes and night sweats. They've not been approved by NICE yet, but they have been approved by MHRA. So soon to be on the market.
Great. Okay. Nice to know that there are more options for people. Are there any lifestyle changes that can make a difference for women who are either perimenopausal or menopausal that you've seen consistently make a difference?
Yes, exercise, simple things like walking, eating correctly. What women often call the clinic to discuss is weight gain during menopause. And it's simple when we think about it. During the younger years of a lady's life, her body puts a lot of those calories into ovary management, hair management, skin management, the fertility areas of the lady's body. And when a lady becomes menopausal, the body realizes that it's not efficient to put those calories in those areas anymore. But the individual doesn't change anything. We don't change the way we eat when we get to 45. No one tells us to do anything like that. So hence why weight gain occurs, because your body just stores those calories. So exercise is incredibly important, especially for weight gain. I appreciate there are lots of GLP-1 injections that patients can often take these days as well, have their own interactions with HRT. But yeah, exercise. I always recommend to patients cognitive improvement as well, things like Sudokus, Wordles. I've never done a Wordle before, but apparently they're quite interesting. Crosswords. Patients often think that they will go on HRT and their cognitive improvement will occur quite quickly, and that's not always the case. The best way to manage the cognitive symptoms is to train the brain to work the way that we want it to work. I think it's not fair or unrealistic to expect the HRT to almost make us think quicker or better. It's really hard to achieve.
Yeah. Well, and something we've talked about on the podcast before is neuroplasticity and how responsive the brain is to changes. So you can basically create new neural pathways and things like that through repetition. So brain training sounds like a great idea for women and men as they're reaching those ages, not just women. Yeah, that's great. So it sounds like there are certain lifestyle changes that can be really helpful. Is there a certain age around which time you'd tell women, okay, you need to really prioritize your exercise now, or it's probably a good time to start doing brain training? Is there an age you would say that?
In the ideal world, no. I think everyone should be doing it, men and women, regardless of age.
Yeah.
However, when we do our group consultations, those women that are attending, or our individual consultations with patients, the women that are attending are all around perimenopausal age or having symptoms. So that's usually the first time anyone gets any menopause education. It's not something that's taught in school.
Right.
We probably get a day a week in a module at university. It's not as prioritized as I would like it to be. But yeah, so I think there almost needs to be a national push to try to get patients to be more mindful and to talk about menopause and the things they can do now that will help them later in life.
Brilliant. And we mentioned earlier in the podcast that menopause doesn't just affect the person going through it, but there can be ripple effects for the family, for the partner, maybe even in the workplace. How have you seen menopause affecting partners specifically?
The Menopause Hub did a survey for men, and they identified 8% of men contemplated ending their relationship and marriage. Wow. And I appreciate 8% doesn't sound like a lot, but that's someone's marriage, that's someone's life for such a long period of time. Because they didn't understand or couldn't appreciate what the lady was going through. And I found that really shocking. So menopause affects everyone, the way you are at work with your colleagues, the relationship that you have with your husband, the libido. We're all a bit scared to talk about sex. And I don't think we should be. I think sex is natural and we should be open to speak about it. But being able to sit down with your partner to discuss your menopausal symptoms, I think is so important. All the group consultations that I've done around the world, I've only had one partner come with their perimenopausal partner, which I've always found really staggering. I actually went to speak to him at the end of the talk because I just found it so inspirational that he cared enough about his partner to come. And I would encourage all women, when you go for your menopause consultations, if you choose to go for a menopause consultation at your GP surgeries or pharmacies, etc., take your partner with you. in our consultation, we send patients lots of videos to help educate them on menopause. And we encourage that they share that video with their partner, watch it in bed when they're sat together, so the male part of that couple can start to appreciate what their partner is going through, because it isn't an easy part of a female's life. And I think it's important that couples work together to manage that transition.
Yeah, absolutely. So are there any ways based on your experience, that a man or a partner can support the partner who's going through menopause, or that the person going through it themselves can maybe talk to that person to try to make the relationship stronger rather than for cracks to start appearing at this time?
I think having an open and honest conversation is where it starts. Almost listing the symptoms that you're getting and discussing it with your partner. Patients often joke during their consultations when I ask about mood fluctuations and anxiety. They say, "Oh, you might need to speak to my partner about that one."
Yeah.
And it's always a nice little way of breaking the awkward silence sometimes. But I think discussing it with them. One thing I'd like to see a lot more is men taking the initiative. I'd like to see a lot more workplaces and companies educating men on menopause. Too often workplaces will do a menopause talk and it'll just be the female employees that turn up. Why is and should that be the case? We all have daughters, mothers, wives. I think the initiative has to be on men to want to learn and to want to help the people around them. And I don't just mean partners, colleagues at work as well, because we spend a lot of time at work and it's often overlooked, and we think menopause just happens at home. It doesn't. It follows you everywhere.
Well, that's a great segue into where I wanted to go next, which was, how can the workplace help to support women who are going through this time? Because my understanding is that there can be quite a substantial impact on a person's working life if they're going through menopause.
I made a video about this recently, and it identified that 13% of women had left their work, had just packed it in because of menopausal symptoms. 13 would drop their hours or change their role or step down. And we need to move away from that. We need to be more flexible and understanding as employers. Part of the Women's Health Strategy in 2020 under the Conservative government identified that workplaces needed to do more to help women in menopause. And there has been 2 or 3 groups that have been created which allow workplaces to get menopause-friendly accreditations. So that's a helpful thing. So they will provide speakers to go in and talk to all staff on menopause. They'll provide information for colleagues about menopause and how to manage the symptoms, when to seek help, what to look out for. So little things like that, I think, go a long way.
So sounds like training
Absolutely
is an important part of it. Are there any concrete things that workplaces can offer to women going through this?
There is nothing set out in law that workplaces need to provide in similar to maternity cover or paternity cover. Nothing currently. I think that will change in the foreseeable future, but nothing as it currently stands. What I'd like to say, good employers will offer simple things like good air conditioning, or maybe a fan, or a room for women to go in and just take 5 and get away from the stresses of day to day. The ability for women within the workspace to openly talk about their symptoms and to promote that, rather it just be done in staff rooms. I got a lot of teachers within our clinic, and they often say that they talk about menopause within their staff room at lunchtime, and that seems to be their protected place. And I think that needs to apply to all workplaces. To promote the conversation of menopause and for it not to be a taboo topic.
Yeah. So as you're talking, I'm thinking about one-to-ones and making sure that managers understand what the symptoms are, how they might impact women, especially if they're men and they don't have much potentially knowledge about it, to help them to understand and be able to offer some flexibility. I would imagine flexible working might be helpful as well.
Yeah. When it comes to one-to-ones, I think they're important and it's definitely doable. We have to be sensitive how we incorporate these into one-to-ones. Some people just don't like talking about menopause. Some people don't like to talk about their symptoms and will manage, and it's important to be respectful of the individual.
Sure.
But I think it's good to have that option to say, how is everything going? You never want to assume that someone is going through menopause, because it can create a negative effect sometimes. And you just want to create an open space for people to voice their opinion and their feelings should they need to.
Yeah, that's a really great point. Really great point. And so if there were discussions as a workplace on the whole saying, we are a menopause supportive community, these are some of the things on offer, that might make it easier for the woman going through it to go to their manager and say, I think I could benefit from these things, rather than the manager to say, so.
I think the worry from and I think the worry from a female's point of view is they might feel that the manager, the employer, will judge their symptoms and feel that they're not performing because they're menopausal. And that shouldn't be the case.
Okay.
But that can be a fear that women will often have, that the individual isn't going to understand what I'm going through and therefore thinks my performance isn't where it should be. And that's why I think creating an open and friendly environment is the key part of how we move forward in society.
Yeah, I agree. That's really great. So you run the first pharmacist-led menopause clinic in the UK?
Yeah, in the UK.
In the UK,
I'm unsure if there was other ones pre my clinic. We set it up about 5 years ago. So when pharmacists first moved into general practice, under the additional roles reimbursement scheme, under the DES contract, Direct Enhanced Specification, under the previous GP contract effectively. And it's changed my life. Honestly, it's been the best thing. We have lots of specialist clinics all run by pharmacists: ADHD, diabetes, lipid, heart failure, atrial fibrillation. And the Women's Health Hub, the menopause clinic, is my favourite of all the things I've created with my team. And all my pharmacists that carry the clinics out are all or have completed the Advanced British Menopause Society course. They're all on the path to become specialists like myself. And the reason why we do it this way is to reduce women having to go private, as well as improving or reducing the workload on our GP colleagues, reducing unnecessary secondary care referrals, and improving the overall knowledge of menopause within our pharmacy team.
That's great. So it sounds like there's been a massive impact. Yeah.
People often look at our clinic and think, like, we've reduced secondary care referrals by 35%, we've increased HRT prescribing by 21%. And what I often say to people is, we didn't achieve any of this overnight. It's taken me 6 years to get to this point that I am today, and I've done that with so much help and support from colleagues, friends, and families. But it's been the best decision, best thing I ever created.
That's great. And so if you were giving advice to a pharmacist who's interested in working in this area, what would you advise them to do?
Firstly, do it. Absolutely. My long-term vision, I'm currently under the NHS Clinical Entrepreneur Programme, and my vision for that with my innovation is that every GP surgery will have a pharmacist-led menopause clinic. I'm working with a few pharma companies to open menopause clinics in community pharmacies now as well. I want patients to be able to walk into a community pharmacy and get HRT in the same way that we have the contraception service as it currently stands. I don't want there to be any barriers should someone want HRT. And that's going to take a workforce. And I have done a lot of work in changing that. We have a lot more pharmacists that are doing menopause clinics now than it was 5 years ago. So my advice is start. Everything I learned from reading guidelines, going on the BMS courses, attending conferences, speaking to people. And what I often say to patients, a bit of tongue in cheek, is, and to my staff, like, I'm a 35-year-old male. If I can learn it, anyone can learn it. And when you start to look at it, I appreciate it looks really complicated from the outside, and there's lots of different HRT options available, and the risk of cancer can often be off-putting for pharmacists. But the world really is your oyster, and once you get the basics sorted, the rest of it falls into place pretty easily.
Okay. And you mentioned training with the BMS, that's the British Menopause Society?
Yeah, so the British Menopause Society are a charity by registration, but they govern and preside over all menopause specialists in the country. They put out lots of free and available resources. They have a patient arm, so if you ever need to give your patient any information, they have a patient arm. It's called the womenshealthconcern.org. And their training is all accredited, so it is perfect. What I've created now is the British Menopause Pharmacy Society, because I want a similar model, but I want it to be for pharmacists. What I've always found within the BMS, and they have been amazing to me, and I've loved my journey with them, is it can often be quite targeted towards GPs, consultants and nurses. So I've wanted to create a community and a society for pharmacists that want to specialise in menopause, and for it to be a safe space. I often find that healthcare, and particularly pharmacy, can be really competitive, and people aren't always willing to share their knowledge and their work. And I'm a northerner through and through, and it's my best trait, I think, and I give everything away to anyone that wants it, because it's not about my success, it's about us as a humanity and what we can do to help the people around us. So yeah, reach out, I will help you in any way I can.
That's brilliant. So that gives people, I think, some concrete things that they can do if this is an area they're really interested in branching out into. So that's great. What do you see as being the future for treating menopause?
I think I'll give you a few clues on that, but I will delve into it.
Yeah.
So within my menopause clinic, we use lots of AI generated videos. So when HRT can be really confusing, and if it's confusing for a clinician, imagine what it is for a patient. When do you take the estrogen? When do you take the progesterone? If the patient's already taken testosterone, what about vaginal options? And there's so many gels, patches, tablets, sprays. So it can be really confusing. So what we've done now, and there's only a matter of time till I think this is the way the world goes, is we send patients text messages with AI generated videos. So it looks like a human person, she speaks like a human person, and it shows the patient how to put on the medication and how to use that medication. So therefore patients aren't inappropriately coming back to the GP surgery with confusion or postmenopausal bleeding or side effects or anything like that, because they're using the medication appropriately, and they can watch that video back a million times if they wish to. So that's the first thing. The use of digital health within menopause clinics is the future. My dream is that every GP surgery has a pharmacist-led menopause clinic. Our clinic works on a Saturday and an evening, and I would like every GP surgery to have that. Long term, I'd like patients to be able to walk into their community pharmacy and obtain HRT rather than having to have that 8 o'clock rush and being number 323 in line at the GP surgery reception team to get an appointment. I want patients to be able to have first-hand access to not only an expert but also the HRT they need.
That's brilliant. And so to finish off, for anybody who's going through menopause or approaching it, what would be your top 3 tips for them as they're stepping into this time of life?
I think the first one is educate yourself. The NHS Menopause website has got a real vamp up since the Women's Health Concern or the Women's Health Strategy in 2020. So please list all the symptoms, options available, risks, benefits, and it's all listed on there with lots of videos as well for those people that don't like reading, similar to myself. So that'd be the first thing. Second thing, speak to the people around you. I often say this to patients: when you want to go on HRT, it's best finding the treatment that works best for you, rather than the first thing that comes to my mind that I think is best for you. Because I don't know if you're a triathlete or how many showers you take a day, and about tailoring the treatment to the patient. So I often ask to the patient, speak to your friends, speak to your family, find out what works for them. Because you're more likely to be successful on a treatment you know works for someone else. Because if that person says, my symptoms are really well managed and I'm getting on really well, you're going to believe that is going to be the case for you. And thirdly, but by no means least, if and when you choose to go on HRT, appreciate that it's not a one-size-fits-all. It's not a life sentence, and you can trial any different HRT and switch between them to get the one that best suits you. Rarely do clinicians get the right treatment for the right patient on the first go.
Okay, so it's worth knowing if it doesn't work for you, it doesn't mean you're not suited to HRT.
Absolutely.
It means you're not suited to that particular intervention, and there might be lots of other ones.
Women are different. People have different skin cells, absorption rates. So HRT can be delivered in lots of different ways.
That's great. Well, Anthony, thank you so much for joining us on the podcast today. It's been a really interesting conversation, and I think people will get a lot out of it. And I hope we've got lots of men as well as women listening. We want this message to really get out to everyone. So thank you very much.
Well, thank you for
coming on today.
Thank you.
Great. We know that menopause can affect pharmacists and their families in many different ways. And we want to remind listeners that we offer a range of support services depending on what you're going through, including access to counseling. Please do visit our website to explore the full range of services available. For specific support around menopause, you might have heard a few of these already, but we would recommend checking out the Menopause Charity, which offers excellent resources and guidance, and the patient arm of the British Menopause Society Women's Health Concern. They host an online menopause wellness hub. For healthcare professionals working or looking to work in the areas of menopause and post-reproductive health, there is the British Menopause Society, who have lots of resources as well. Mm-hmm. For further information on our support services, including counseling and peer support, please click on the How We Can Help link in the podcast description. Please don't hesitate to reach out if you feel you may need support. We want to continue providing our free and confidential support services to open up conversations like this, to ensure that no one in our pharmacy family faces challenging times alone. As an independent charity, we rely on donations from individuals and organizations across the profession to enable us to do this. If you're in a position to do so, please consider making a donation today. You can find the QR code in the show's description or at the end of the video. Donations help us to provide our essential services, including our counseling and peer support, financial assistance, and more. Thank you so much for listening, and we look forward to seeing you again at our next podcast.